Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the posterior triangle of the neck. What is the posterior triangle of the neck? This is a triangular space on the side of the neck behind the sternocleidomastoid muscle. This is the sternocleidomastoid muscle, and the triangle is located behind the sternocleidomastoid muscle. So its anterior boundary is formed by the posterior border of the sternocleidomastoid muscle. Posterior boundary is formed by the anterior border of the trapezius muscle. The base of the the base of the posterior triangle is formed by the upper border of the middle third of the clavicle. Apex is formed by the union point of the sternocleidomastoid and trapezius. Here, this is the apex of the posterior triangle. This is located on the superior nuchal line of the occipital bone. So again, boundary anteriorly by the posterior border of sternocleidomastoid muscle, posteriorly by the anterior border of the trapezius. Base is formed by the upper border of the middle third of the clavicle. Apex is the meeting point of the trapezius and the sternocleidomastoid on the superior nuchal line of the occipital bone. Okay, so if we go to the roof, how the roof is formed? Roof is formed by the skin, superficial fascia, and superficial fascia contain multiple structure, and the roof is also formed by the investing layer of the deep cervical fascia. The superficial fascia contains the platysma. This is the platysma muscle. This is platysma, and platysma muscle is a muscle of facial expression. So it is innervated by the facial nerve, the cervical branch of facial nerve. There is a nerve of the second pharyngeal arch. Okay, so we got that. Then external jugular vein. It is not shown here. External jugular vein we'll find out. It is formed by the union of the posterior auricular vein and the retromandibular vein. It passes over the sternocleidomastoid muscle and end in the subclavian vein. Parts of supraclavicular, great auricular, transverse cutaneous, and lesser occipital nerve. So we got the transverse cutaneous, transverse cervical nerve. These all are cutaneous. These are derived from the cervical plexus, like that the great auricular nerve, lesser occipital nerve, the supraclavicular nerve. They all are the cutaneous branches. They are derived from the cervical plexus. We'll get blood vessels and lymphatics as a content of the posterior triangle of the neck. We have lymphatics, we have superficial group of lymphatics, deep group of lymphatics. Okay. So if we go to the roof, again, roof is formed by the skin, superficial fascia, and the investing layer of deep cervical fascia. It contains what? The great auricular nerve, root value C2, C3, the transverse cervical nerve, root value C2, C3, lesser occipital nerve, root value, the C2, okay, and we have the external jugular vein, a part of the external jugular vein that is formed by the union of the posterior auricular vein and the and the posterior division of the retromandibular vein near the angle of the mandible. We are seeing a part of this, and the external jugular vein opens into the subclavian vein. Okay, here our posterior triangle is divided into two parts, two divisions. The upper larger division is called the occipital triangle. It contains occipital artery, that is a branch of the external carotid artery. It contains lymph node. Lymph node, we have two sets of lymph nodes, superficial and deep. Superficial lymph nodes are passing along the external jugular vein. We have the spinal accessory nerve, there is the 11th cranial nerve that supplies the sternomastoid and the trapezius muscle. So the spinal accessory nerve is the 11th cranial nerve. Also, we're getting C3, C4 nerve. These are providing sensory innervation to the trapezius, mostly the proprioception. Proprioception means that the sense of position and movement, and that is carried by this nerve. These are sensory. They actually sense the position and movement of muscle and the joints. Okay, this part is called the subclavian triangle. Okay, that is the subclavian triangle. It contains subclavian artery, subclavian vein. Okay, plus it also contains part of the brachial plexus, upper trunk, middle trunk, lower trunk, and part of the root, and also branches from the upper trunk like that of the dorsal scapular nerve, and also the upper trunk, the root. We're getting the dorsal scapular nerve from C5 from the upper trunk. Directly from trunk, we're getting the nerve to the subclavius and suprascapular nerve. Okay, so these are the content of the subclavian or supraclavicular triangle. Okay, these are the contents. Again, we found the suprascapular nerve that is coming out of the upper trunk of brachial plexus. We'll get nerve to the subclavius that is also coming from the upper trunk of brachial plexus. From the C5, we'll get the dorsal scapular nerve that supplies the rhomboid muscles. Okay, we got that. Then we have this is the this is the muscle, the omohyoid muscle, inferior belly of the omohyoid muscle. That inferior belly of the omohyoid muscle divides the posterior triangle into the larger one, the occipital triangle, and the smaller one, the supraclavicular or subclavian triangle. Okay, we are looking some nerves and lymphatics, the posterior triangle. Okay, these are the lymphatics. We have superficial group of lymph nodes that follow the external jugular vein. External jugular vein is formed by the union of the posterior auricular vein and posterior division of the retromandibular vein. And we have the external jugular vein here. External jugular vein opens into the subclavian vein. We have some nerve here. We are seeing the accessory nerve that provides innervation to the sternomastoid muscle and the trapezius, that is the motor innervation. We have sensory or cutaneous innervation from the cervical plexus, the supraclavicular nerve, the anterior cutaneous nerve, that is from the transverse cervical branches, great auricular nerve, and lesser occipital nerve. So if you look at that, we have the great auricular nerve, anterior cutaneous nerve. These are also called transverse cervical nerve, and we have the accessory nerve that provide innervation, motor innervation to the trapezius muscle and the sternomastoid muscle. Okay, we got the lesser occipital nerve, and we have the supraclavicular nerve. This is supraclavicular nerve. So these nerves are coming out of the cervical plexus. The accessory nerve is the 11th cranial nerve. Okay, so posterior triangle of the neck, we are coming here. If you look at that, here we'll get the floor of the posterior triangle is formed by the prevertebral layer of this cervical fascia that covers this muscle. What are these muscles? What muscle forms the floor of the posterior triangle? This is formed by the splenius capitis, levator scapulae, the scalene posterior or scalenius posterior, scalenius medius, and also scalenius anterior. Between the scalenus anterior, scalenus medius, we have a gap. Through this gap, the brachial plexus and subclavian vessels passes. Especially the subclavian artery passes between the scalenus anterior, scalenus medius. Subclavian vein does not go through this gap. Subclavian vein passes in front of the scalene anterior. And, and another nerve that is covered by the sternocleidomastoid muscle that passes in front of the scalene anterior, that is the phrenic nerve. Phrenic nerve provides motor innervation to the diaphragm. It also provides innervation to the fibrous pericardium, and also it innervates the mediastinal pleura, and also the right phrenic nerve innervates the gallbladder with other sympathetic and parasympathetic nerves. Okay, we got the prevertebral fascia covering this muscle. Floor is formed by the prevertebral layer of the cervical fascia, and under that fascia we have these muscles. Okay, we got the division of the posterior triangle. How? By the inferior belly of the omohyoid. This is what triangle? The subclavian triangle. Smaller one, larger one is the occipital triangle. This is the occipital triangle. Apex is formed by the union of the sternocleidomastoid and the trapezius at the superior nuchal line of the occipital bone. Okay, so content of posterior triangle, we go there. Content nerve, spinal accessory nerve, branches of cervical plexus, we just discussed that. And we have muscular branches to the levator scapulae from C3, C4, and also from the C5. Okay, so we'll get from the root of the brachial plexus from the C5, supplying the levator scapulae. Okay, and we'll get the innervation to the trapezius by means of the accessory nerve. Okay, upper part of the brachial plexus, we got that, and from the subclavian triangle we get upper, middle, lower trunk of brachial plexus, long thoracic nerve that is coming out of the root C5, C6, C7, and also the dorsal scapular nerve actually comes out of the C5 root that supplies the rhomboid muscle. But here the muscle here, levator scapulae, innervated by C3, C4. Nerve to the subclavius coming out of the upper trunk of brachial plexus. Suprascapular nerve also comes out of the upper trunk of the brachial plexus. Suprascapular nerve innervates the supraspinatus and infraspinatus. Long thoracic nerve innervates the serratus anterior muscle. Okay, we are looking at the external jugular vein here, formed by near the angle of the mandible by the union of the posterior division of the rectomandibular vein and the posterior auricular vein. Rectomandibular vein is formed by the union of the superficial temporal and maxillary vein here. And this is the cervical plexus. We found that formed by the C1, C2, C3. We have the lesser occipital nerve, great auricular nerve, and we have the transverse cervical nerves, or also called anterior cutaneous nerve of the neck. We have this is the ansa cervicalis. Okay, so we'll get this cutaneous nerve. Okay, ansa cervicalis is just inside the further deep on the anterior on the wall of the carotid sheath. Okay, phrenic nerve innervates the diaphragm, the motor innervation of the diaphragm. Also other structure like fibrous pericardium, mediastinal pleura, and also right phrenic nerve innervates the gallbladder along with the other nerves. Okay, so vessels, we have the transverse cervical artery. This is a transverse cervical artery. It is initially part of the supraclavicular triangle, but it goes to the occipital triangle. It has ascending branches also. The occipital artery we have seen in a previous image. It is a branch of the external carotid artery. Subclavian vessels, subclavian artery on the right side is a branch of the brachiocephalic trunk. On the left side, subclavian artery is a direct branch of the arch of the aorta. And subclavian vein along with unites with the internal jugular vein and forms the brachiocephalic vein. And subclavian vein receives the internal jugular vein, also external jugular vein. Suprascapular vessels nerve goes to the suprascapular notch and take part in anastomosis around the scapula. External jugular vein, we discussed that part. Lymph node, we have two sets of lymph nodes, superficial group of lymph nodes and deep group of lymph nodes. Usually superficial group of lymph nodes follow the external jugular vein. Deep group of lymph nodes follow the internal jugular vein. The superficial group of lymph node may be again distributed in different groups like that of the occipital nodes, preauricular node, postauricular node. We have also parotid nodes, multiple nodes. Okay. Ultimately, most of them goes to the deep cervical lymph node. Very important to know that lymph node biopsy may damage the accessory nerve. Okay. So we have to know some of the nerve supply of the muscle, sternocleidomastoid muscle, and the trapezius. This is the nerve supply. We must know splenius capitis nerve supply, levator scapulae, and scalene anterior muscle, scalene medius muscle, scalene posterior muscle, omohyoid nerve supply by the ansa cervicalis, anterior mi of the C1 to C3. Okay, these are the Viva question. What are the boundaries of posterior triangle? We must know that part, and everyone should read that and find out the answers of the structure of the posterior triangle. Okay, and that's all about the anatomy of the posterior triangle. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.